Today we're going to talk about the urinary system. So the urinary system is relatively short and simple compared to a lot of the systems we've looked at up until this point. So with the urinary system, it's going to involve having two kidneys, a bladder, and the tubes that are going to go between things. Functions of the urinary system include regulating the blood ions, regulating the blood pressure and volume, regulating the blood pH, and hormone production. So we've already looked at the hormone production earlier with the circulatory system, with the EPO to produce more red blood cells. So looking at the anatomy of a kidney, around the outside, you're going to have the renal capsule. This is going to cover the outside of the kidney. It's a tough fibrous capsule to protect it. The kidneys are located retroperitoneal, so they are going to be accessed through the posterior side of the body. The kidneys are usually a little bit smaller than your fist. The renal cortex is going to be the outer portion of a kidney. So remember, the cortex of any organ is the outer portion. The renal medulla is the inner portion. Inside the renal medulla, you can see these renal pyramids. They're called that because they are kind of a triangle shape in there. These are going to contain the nephrons. The space in between the pyramids is the renal columns. Then in the center area, you have the renal pelvis. This is going to be where the nephrons will drain. When you look at the shape of the renal pelvis, you can see that there's little cup shapes to that. We call those the calyces. So the major calyces are going to drain the minor calyces. The minor calyces are going to be the little cup shapes that are going to drain the renal pyramids and the collecting ducts from the nephrons. So with the shape of these, if you do have crystals precipitate out, this will help make the crystals a pointier shape, and the crystals themselves would be sharp. So those crystals are what we call kidney stones. When we look at the blood supply to the kidney, the main vessel is the renal artery that's going to carry blood to the kidney to be filtered. This will divide off into multiple afferent arterioles. This branch is going to carry blood to the glomerulus. The glomerulus is a capillary bed that's going to do the initial filtering. And what it will make is glomerular filtrate. So this is going to remove just the big things. That glomerular filtrate will continue on through the nephron for filtering. The blood, after it's passed through the glomerulus, will exit through the efferent arteriole, and then finally exit through the renal vein. That's going to carry away the filtered blood. The peritubular capillaries are going to surround the loop of Henle in the nephron. This is a way to try and get some tubular reabsorption to pull some of the fluid back in so that we don't have as much water loss through the kidneys. The nephron is the main functional unit of the kidney. The renal corpuscle is going to be the start of it. It's the glomerulus and then the capsule around it. That will connect to the renal tubule. So as the glomerulus allows that glomerular filtrate to go through, it will go into the Bowman's capsule. It's going to be a capsular structure. It's sometimes called the glomerular capsule. That will join into the renal tubule. This will carry the filtrate after it leaves, and this tube is going to change names as it proceeds along the way. So remember that glomerular filtrate, this is the filtered plasma after it's gone through the glomerulus. So this picture here is showing a nephron. You can see right here you've got a Bowman's capsule around the glomerulus. And then it's going to lead to the renal tubule. So this initial part of the renal tubule is going to be the proximal convoluted tubule. It's called proximal because it's the closest to the glomerulus. It's convoluted because it takes a curvy route. After going through that curvy area, it's going to change into the loop of Henle. This portion is going to extend down deeper into the renal pyramids, and this portion is surrounded by the peritubular capillaries. That's going to allow some of this fluid, as it moves down here, to move back into the capillaries so that it's not lost. After you come back up, you're going to reach the distal convoluted tubule. Again, another curvy portion. It's just farther away from the glomerulus. And then it will finally come into the collecting duct. So you can have a single collecting duct that will collect fluid from multiple different nephrons, but it will carry it down to the calyces in the renal pelvis. So in this picture here, you can see all of these blood vessels in here are very tiny. That's why the kidneys are so susceptible to damage in a diabetic. High blood glucose is very damaging to tiny little blood vessels that you have in the kidneys. So down here, this is a picture that's got a kidney's nephron a little bit more spread out. You can see the glomerulus here. You're going to have the blood flow go in through the afferent, out through the efferent. The Bowman's capsule is around it. It's going to move through the proximal convoluted tubule, down to the loop of Henle, back up, and then into the distal convoluted tubule. And you'll have the collecting duct here to drain it. So this one shows where sodium gets moved, where water is going to get moved in and out, and the effects of aldosterone and ADH. So when we look at nephron function, the first thing that happens is glomerular filtration. This is the initial filtration that's going to remove the cells and the larger molecules from the plasma. This will include glucose up to about 170 milligrams per deciliter. So when it gets above that, it will actually start to spill into the urine. So fortunately, we do have modern lab equipment and easy tests that will measure glucose levels now. In the past, before we had all that technology, the way they would test for diabetes is somebody got to taste the urine to see if it was sweet. So tubular reabsorption, here we're going to pull some of the water and ions back into the kidney. If we move sodium, the water is going to follow the sodium. So this will take place in the loop of Henle. Then we have some tubular secretion where you're going to put water and ions back into the urine as necessary. So filtering is basically just a process of moving things back and forth across the membrane. So this will take part in part of the loop of Henle and the collecting duct. So this picture here, I do like this one. You can see as you move down to the darker area, it gives the concentration of the sodium. As you move down the loop of Henle, the sodium concentration is greater, and that's going to pull more water out of the loop of Henle and stick it back into the peritubular capillaries. So hormonal influence, the RAA system that we talked about in the circulatory system. This is going to increase the sodium retention and therefore the water retention. This will decrease the amount of urine that is produced. ADH, antidiuretic hormone, this is also going to increase water retention and decrease the urine volume. So urine is the fluid that's formed after it's passed through the nephron. It should be a pale straw color and translucent. If it's foggy, it indicates an infection. There are things that will cause the color to be altered that are not necessarily a reason for concern. When a person takes B vitamins, it's not unusual to have the urine be bright yellow. It's almost a neon yellow, like a highlighter. And sometimes if a person consumes too many beets, the urine can have a pinkish red color to it as well. The ureters are the tubes that are going to drain the kidneys into the urinary bladder. The urinary bladder is basically a sac to store the urine for a more convenient time for excretion. Conveniently, where the ureters are going to come into the urinary bladder is on the posterior lower 1/3. So as the bladder starts to fill up, especially when lying supine, it's going to put pressure and be a mechanical valve to close off the ureters to prevent backflow of the urine back up into the kidney. It's also going to help keep some of the urine that's produced in the kidney from going back down into the bladder. That will allow you to rest a little bit more before feeling like you have to urinate. So you've probably experienced when you get up in the morning, first thing when you get out of bed, or you roll over, you unpinch those tubes, and it does not take long before you have the urge to urinate. The urethra is going to be a tube that runs from the bladder to the external body. So the trigone is the inferior 1/3 of the bladder. It's a more muscular area. So the urethra has a couple of sphincter muscles. The external urethral orifice and sphincter is going to be the opening from the urethra to the external body. The sphincter muscle there is under voluntary control. The internal urethral orifice and sphincter is the opening from the urethra to the urinary bladder. This is under autonomic control. So at some point, if you have not taken the hint that it is time to empty the bladder, it's going to release this for you. And at that point, you have your external urethral sphincter trying to hold that, but it's not going to give you very long. You're usually going to be making a run to a toilet at that point. So micturition is the process of urination. So a couple things that are not in the notes but are usually of significance and interest to people here. As you age with urinary tract infections, they tend to be less uncomfortable. So you may think that's a nice trade-off to not have the discomfort anymore, but one of the things that you are more likely to see with an older person is some signs of dementia that go with it instead. So that's not really a great trade-off in there. But for an older person, they may have no discomfort at all and just may be acting hostile and unreasonable. So for females, these muscles here do tend to weaken with hormonal changes. For a lot of women, it will be noticeable even during pregnancy and after giving birth that they just aren't able to hold the urine as long. For men, what will happen is the prostate gland grows their entire life. It's shaped like a donut around the urethra. And so if that gets too large, it will actually pinch off the urethra and they'll have difficulty starting the urine stream. That makes them more set up and more prone to urinary tract infections as they get older. So both males and females have some unpleasantries that go along with the urinary system as you get older.